A man presenting to his GP at the age of 50 with his erection problems, we now know that given no other parameters in life, most of those men will have their first heart attack 10 years later. In other words, the erection problem is heralding a health issue in that man. So number one, erection problems should be in the hands of general practitioners and people versed in their treatment. Two, when you've had erection problems and you've gone through all of the gamuts of treatment, now we're coming into our post-radical surgical patients, they should tell their GPs that they need to be reviewed. They should go back to their specialist who operated on them and seek further advice and referral where appropriate. All men who are heading towards radical intervention for prostate cancer, whether it's surgery, radiotherapy or hormone treatment, really need to understand that prostate cancer treatment can end up with erectile failure, impotence in the old terminology. Whatever treatment one has, there is a 50% chance of some erectile failure, but like a lot of things in life, if you're confronted with a life and death issue, having your cancer, your major problem treated, then gives us the chance to go back and re-evaluate and then try and re-establish normal function for men. And most men after 6 months are starting to feel that they've got over the problem, they're now moving on with life. We usually start with conservative measures. We like to see if they would entertain using a vacuum device, maybe injection therapy into the penis, and then occasionally we'll start them on a tablet oral implementation. The use of Viagras and tablets of that type are limited in this area until the nerves have recovered to the erectile tissue. And part of the rehabilitation may be to use these to try and stimulate an earlier recovery, but on their own they won't create a recovery situation. At the end of about 2 years, if a man's erections are still dormant, but despite every treatment, I prefer the best option is penile implantation surgery. This is a technique which allows a normal erection, normal sensation, ejaculation. It's, to me, and I'm a surgeon of course, it's less cumbersome. You don't have to carry drugs through customs. You can be part of you. It doesn't have machinery that goes off through a Geiger counter or something. So patients are given a lot more liberty. And so I encourage men who are undergoing treatment to look at that option. There is, to me, no question that at the end of the day, a young man recovered, free of his cancer, if every other option's failed, implantation with an erectile device is an excellent option. Now, I'm in a situation where I have actually audited my data with patients, and I can say quite honestly that we know that 85% of our patients are totally satisfied. They say that they are able to have good communication with their partner, good sexual relationships, and they are totally satisfied. 10% of men say that it's not as good as the real thing, and they think that they'd like to be 21 again. We can't ever do that to them. And 5% of men will have an implant hoping that it would revive their libido and their sexual prowess. But in fact, it doesn't do that, and they have to understand it is only a device that offers the ability to sustain penetrating sexual function. And when we surveyed the partners of men, 85% of women say they're very satisfied that their husbands are back, their men are there again, that they can have good relationships, that they're a party to the activity. And we teach our female partners as well how to pump the device, how to be party to the whole activity. An implant is totally contained within the patient. He can walk around, look normal. He can get changed in a golf club and people won't know he's got an implant. He has got a little swelling in the scrotum, which is the pump mechanism, and the cylinders which are in the penis are inflated with saline. And so of an evening when there's a more amorous attitude and it's nudge, nudge, wink, wink, tonight's the night, the patient can reach down, have a pumping mechanism, sustain an erection, and have a functional activity which is as close to normal as nature can provide in this time. So I really do find that penile implantation surgery is a very effective rehabilitation surgery that we are obliged to undertake for patients who are left bereft after they've had these sort of interventions.